Thank you so much for that. Our next topic addresses an issue that is often hidden in plain sight: food insecurity among older adults. For many seniors, the rising cost of food, healthcare, and housing has made access to nutritional meals increasingly difficult. So now, question 2.
Thank you to all the candidates. My name is Nancy Pines. Washington, D.C. has one of the highest rates of senior hunger in the country, and federal food assistance programs, including SNAP, are facing dramatic cuts. What specific steps will you take as mayor to ensure that no older adult in Washington goes hungry, and how will you replace what the federal government is taking away? Thank you.
I will start because this is an issue I'm very passionate about. I often do these things in my work are peer days, and I knock senior doors. And the number one thing that happens is when I look in the refrigerator, I do not see food in the refrigerator. This is a cost of food. It's why I fought so hard for giving SNAP rates. What was that? The federal government had gone down 10% on SNAP benefits, and I said the city should step in and fill that gap. It ended up going all the way to a fight and a lawsuit. That wasn't necessary because the administration didn't want to fund the give the SNAP raise that I had put in the budget, but it was critical. And so for me, it is making sure that we give SNAP raise and we supplement what the federal government is cutting. We also need to provide, work with more of our senior providers to provide in-home meals. Many of our seniors don't, and in-home meals, and not many seniors have to go to the senior centers to pick up their meals. There are transportation barriers for our seniors, and we have to recognize those transportation barriers for our seniors and provide hot-home meals and work with our providers to do that work. The other issue is making sure that our seniors, when they are getting the food they need, that this is food of quality that they can eat, that they can support it. I go our senior centers in Ward 4, we have had homes for teachers, Iona, and one thing our seniors say to us is, look, we want healthy meals to be able to eat, and we want them to be able to sustain our bodies, our fitness, and brain to have it thrive. It's why I created the Council, the Food Insecurity Council. Again, I always say, DC doesn't have to create anything new, we have to listen to the experts, and by listening to our Food Insecurity Council, I believe that we can take the steps to close this gap for our seniors.
First thing that we're going to do is have markets, just make food accessible throughout the entire state. So it's in my private sector life, we help bring the Heritage grocery store to now. To be able to be provided food, it's got to be accessible. So we're working on markets. We're also in the process of building eat-to-work farms. We're going to produce produce here in Washington, D.C., so that, again, we can distribute it throughout our city and actually reduce the food prices in some small measure. The second is that we're going to work with our nonprofit providers. A bunch of my team members and I volunteered for the city last week, 2 weeks ago, and that is a good example of a facility being in the community, being accessible, and understanding how all the food is coming in and how it's all being distributed. The third thing is that when I was in college, I would do meals on wheels. I would deliver meals directly to people in middle central Pennsylvania, to people. So we have the transportation capabilities, and talk more about my transportation plan, but we will make it so that we are bringing food directly to residents, because again, we will make it easy and accessible for all food to be delivered to DC residents. Thanks.
So I'll mention 2 things I would actively do, and then I want to get into what I find is the real root of this issue. So one, I would direct the Department of Aging and Community Living to conduct an annual needs assessment of our unmet meal demand by ward and actually publish the results publicly so that funding gaps are actually visible and addressable. So on the home delivery piece, I think that's very, very important for us to do. And then we have the SNAP enrollment rate issue. So we need to actually have SNAP outreach that's targeted so we can make sure there's in-person assistants at senior centers. I was just having a conversation with the resident here that as much as we appreciate the technology, I'm from the technology sector, the in-person accessibility at the end of the day is going to be so important for our seniors. So the next mayor needs to make sure to do things to happen that way. On the ride over here though, my team and I were discussing that our SNAP processing rates are actually half of that of Chicago's. It's so slow here to actually process your benefits. And the way that I find issue with the system is that DC government has been appointing people with loyalty in mind as opposed to expertise. And that is one of the biggest issues that I have with our DC government and how it functions today. So what we need to see is a concerted effort to appoint the right agency heads so we can get the right people who know how to run these agencies and make sure all the services we care about as Democrats are working for you. There's real service delivery, there's real customer service, and that's going to be one of the most important actions I can take as mayor. Thank you.
I would just say that we have to get past all the barriers. Because of the past 10 years, we've been going on with providing food to our older citizens that need it. 1 in 9 DC older individuals lack healthy food and have a good quality life. We have about 12 programs that are supposed to deliver these foods, these meals, and make sure that we have a very efficient and effective system. But we're talking about today because it doesn't work. They have not been executing it properly. Now here today, there is extra $400 million just popped out of the sky. So the council has $400 million. Now we discuss about how we're going to fund the cuts. So where there's a will, there's a way. Let's see how they're going to do this $400 million. I've been saying throughout this campaign that we do not have a money problem. We have a management problem. When you have $22 billion for 700,000 residents, you do not have a money problem. We generate $12 billion from the taxpayers. Another $5.5 billion comes from the federal government. Another $4.5 billion comes from the enterprise zones that we have that generate these dollars. So when you look at it, we have the dollars to get the job done. It's just, do we have the will to get it done? We're really looking at these dollars. We talk about public, let's stop, I'll get to that a little later. But we have the dollars, we have a management problem. We do not have a money problem.
Thank you for that, I'm sorry to cut you off. All right, we'll transition into our next topic, which is diversity around Latino and immigrant elders. As DC older adult population becomes increasingly diverse, it is critical that basic services, health care access, and community support reflect the needs of immigrants and multilingual communities. So now we'll have question number 3.
Good afternoon, everybody. My name is Norma Shorn. I am a senior, I am a Latina, and I live in the District of Columbia. I am very proud to be a senior center member. My question is, if you are elected, what concrete commitments will you make in your first year to protect Latino, immigrants, and low-income seniors in the district, and to create safe, welcoming places where we can continue making community?
Thank you for the